Let's have a look at the basic mobilization techniques of the hip joint. The hip joint is so much inside of the body, it's not so easy to mobilize it like the knee or the ankle joint. We don't have a real grasp straight to the bones. We always work through a lot of soft tissue. Our movements, we have flexion to control exactly how much is really the iliofemoral movement. I put my hand under the pelvis, I hold here the iliac crest, and then when I move I can feel exactly where hip flexion ends and the pelvic movement starts. So to assess flexion I do it like this. The rotations, internal, external rotation, the inner arch, I go to flexion and then towards adduction. I have abduction. If I'm not sure, I again hold here and I bring it up. We have straight leg raise. And I always check as well the rotation in extension of the hip. These are the main movements. Now, for every hip problem with a pain, you can use the longitudinal mobilization. The loose position of the hip is slightly flexion, slightly external rotation, and slightly abduction. So I hold here, and if it is a young man, as our gentleman, I can do it like this. If we have a knee problem, I just support the knee. When the knee is in extension position, I have a blocked situation, so my pull arrives straight on the hip. This is the loose position of the hip, doing constant static traction or mobilization. This technique helps to stretch, and it helps as well to reduce pain. It can be made very softly, gently as well. We have a technique which you can do like this. It is anterior, posterior pressure. I can do it in more extension, putting my knee under his knee. I always moving 90 degrees to the femur, going close to the joint. And a very helpful technique is distraction again. I put my hand here, my shoulder is here, and now I'm pulling outwards. That means along the neck of the femur. This is a very pain relieving movement. I can do it static or I can do it by mobilization. On the hip, the work on the soft tissue is very important. A gentle technique just to relax the muscles is this. I hold the knee here, the femur, and I do this shaking of the muscles, inviting the muscle to relax. Massaging them. Even the back part, starting by the ischial bones, coming up here, and from classical massage, the quadriceps technique, and then here on the hip, on the iliac bone, laterally between the trochanter and the iliac crest, we have this tensor fasciolata. It's a muscle comes down here. This muscle very often is so tense, so you massage it, you stretch it with your thumb, double thumb technique, to relax. A very helpful stretching technique here for this muscle is I bend the knee, I bring it over, I hold these muscles and then I stretch them. And I can bring it outside. So I go in here with my fingers, I hold that tendon, I stretch and slowly I go outside. For the hamstring stretch, I can use this position. I bring the foot on a vertical position. It shows up to the sky. And then I'm coming up like this. Here we prefer a static stretching. I'm not moving up and down. I just do a static, slow stretch so the tissue has time to be stretched. I'm careful that the foot doesn't come out, because when I mobilize like this, it's another part of the muscle which will be stretched. I want to have a symmetric stretch. I hold the hip joint in a middle rotation. Let's remember, for all hip patients, it's so vital to lie on the belly every day, lying in the belly to stretch out nicely the hip. If we have pain on the flexor side, it is helpful to go here to the spinal iliac anterior superior, and just on the inside I'm going down and I'm touching iliacus muscle. It's a part of iliopsoas muscle, and I just hold that muscle. So with the pressure of the muscle belly I can reduce the tension of iliacus and I will free the hip extension. This is a reflexoric method. It comes from my reflexology and is very helpful to reduce hypertone in iliac muscle. These are basic mobilization and soft tissue technique to help to free the hip joint.